Welcome to my YouTube classroom. This is the part 4 of the Philippine Nursing Law lecture. Article 4 is our next topic. And this is about the examination and registration. The examination that nurses must take so that they can be licensed to practice nursing in the Philippines is the Philippine Nurse Licensure Examination. This is otherwise known as the PNLE or simply the NLE. And we refer to it most of the time as the board examination. Now, before a BSN graduate can get his license, he must first apply for and take, then pass the NLE. As discussed before, it is the BON who has the duty to conduct the nurse licensure examination. They are responsible for the scope, the format, and content of the licensure examination, while the PRC is responsible for scheduling and assigning the venues and the dates of the board examination. And it is also stipulated in Article 12 that all board examinations shall be under RA 8981. So what is RA 8981? It is known as the PRC Modernization Act of 2001. Now, what is this act all about? It is about the computerization of all the board exams. Now, let us enumerate the qualifications needed when applying to take the Philippine Nurse Licensure Exam. The first one is you have to be a Filipino citizen. Number 2, you have to be a graduate of the Bachelor of Science in Nursing. And the third one is having good moral character. So the first qualification again is that you have to be a Filipino citizen. For example, your parents are both Filipinos. Can you take the NLE? Yes, because you are a natural-born Filipino citizen. It means that you are allowed to take the board examination. But what if you are a foreigner who is now a naturalized Filipino citizen? Will the PRC allow you to take the NLE? The answer again is yes. In the law, it is just stated that you have to be a Filipino citizen. So it doesn't matter if you are a natural-born Filipino citizen or a naturalized citizen. As long as you are a Filipino citizen, you are qualified to take the Philippine Nurses Licensure Examination. But what if you are a foreigner? You are a citizen from another country. Can the PRC allow you to take the NLE? The answer is also yes. But only if the country that you came from has a reciprocity treaty with the Philippines. We will discuss what is reciprocity treaty in the latter part of this lecture. The second qualification is that you have to be a BSN graduate. You have to present proof that you're a BSN graduate. The graduate must present to the PRC their transcript of records and their RLE requirements. And these documents must be genuine. The third is that you have to be of good moral character. As I've mentioned, all the documents that an applicant will submit to the BON must be authentic. Otherwise, if found that documents are fraudulent, it can be a ground for the disqualification in taking the licensure examination. So there are only 3 requirements. You have to be a Filipino citizen, a BSN graduate, and of good moral character. Now, what if someone graduated at the age of 16? Can she take the nurse licensure examination? The answer is yes. There's no age requirement for taking the licensure examination. But can she receive the license at the age of 16? The answer is no. Her license is deemed to be suspended until she reaches the age of 18. The age of 18 is the age of maturity or the age of majority as according to RA 6809. That is the end of part 4. There's no post-test on this video. That's the end of part 4. See you on part 5. Bye!